Hi, and welcome to this on-demand training on tips and tricks for being successful in the workplace. This on-demand training is brought to you by the Health Center Association of Nebraska, also known as HCAN. For more information, please click on the link below. In today's discussion, we're going to learn how to be successful in the workplace by 1. Mastering time management techniques, 2. Fostering strong communication skills, and 3. How to be a team player. All right, so let's look at how to master time management techniques. Remember, effective time management helps to balance tasks at work. Regardless of what role you have in your community health center, having time management helps with patient care and satisfaction. So, a couple of tips to help with time management. Number 1, prioritize your tasks by planning your day in advance and using organizational tools. Working in a community health center at times feels like every day is unique. There are no 2 days alike, but there may be some tasks that you need to do on a daily basis, whether it be reminding patients of their appointment for the next day, calling back patients to let them know of their lab results, or stocking the supplies in the exam room to get ready for the next patient. These are tasks that you can make a list of that should be completed each day. Number 2, try and address tasks as they come up so you can manage your time more efficiently. In your role, more than likely, being able to multitask is really important, so you'll have to make decisions of what to complete first. Be sure to use your critical thinking skills of what is the most important task to complete and then do it. And remember, don't procrastinate or you may forget to complete the task. Another help to mastering time management is the use of technology. In your role, you may be using various computer programs, but there may be one, such as the electronic health record or the EHR, that you probably may use a lot. Regardless of which EHR your health center uses, make sure that you receive training on how to use it and if there's any shortcuts. For example, maybe there may be a way to decrease the number of clicks to get to the intake form, or how to document patient demographics. Remember, using shortcuts doesn't mean completing only half of the job, so make sure you ask for additional training if you need it. And finally, number 3, minimize interruptions. If needed, set boundaries during focused work periods. Perhaps you've been tasked to complete a project that needs to be done in an hour or to collect some data for a grant that's due. It's okay to tell your colleagues that you need to complete some work and need some quiet time so you can make sure that what you're doing is being completed accurately. Let's look at fostering strong communication skills. Remember, having strong communication skills are vital in our field and because it really helps to build trust with colleagues and patients, having improved collaboration, and also improving patient outcomes. Here are some strategies to help enhance strong communication skills. Number 1, listen attentively. Perhaps you've heard that phrase, listen for the sake of listening and not to respond. Remember, whether it's our colleagues or patients are speaking, we want to show concern or empathy, maintain eye contact, and avoid interrupting. Remember to take into account an individual's culture and any additional needs they may have. We want to respect cultural norms and beliefs, and we don't want to interrupt or we may miss something that we may need to know about, so be sure to understand their concerns before responding. Number 2, let's look at conflict resolution. There may be times that you may face a challenging situation with a colleague or a patient. Remember, none of us are perfect, and so we want to make sure that we always address any conflict professionally and respectfully. Remember, if it was reversed, how would you want to be treated? Try and seek a common ground and collaborate on solutions. Sometimes, honestly, a solution to a problem or challenge may come from an idea that we didn't think about. If that happens, also ask for help from your supervisor or read your employee's handbook or policies or procedures. And 3, think about self-awareness. It's so important to have self-reflection and self-awareness. So think about your own communication style and adapt as needed. Perhaps we may be talking and cross our arms, or maybe our tone of voice may sound tense. Sometimes it's not what we say, but how it's said. So we want to make sure we're mindful and take advantage of any trainings to improve our skills. Finally, let's kind of look at being a team player. Remember that being a team player is essential for maintaining a positive work environment. Here are some strategies that may help. Number one, recognize the value of a team. Remember, if we think about our team as a football team, a quarterback can't be the only player on the team. They need the rest of the players in each of their role to score a touchdown. It's kind of the same analogy with our community health center. We have to work together to complete tasks. If we don't have someone to answer the phone, room a patient, or have a provider diagnose the patient, we won't be able to provide high quality care. Please commit to building and working with colleagues, and remember you are part of a team and your actions have an impact on others and the quality of care provided by your health center. Two, think about team-based care. Each colleague in your health center has a unique skill set. Maybe someone's bilingual. Maybe another member has a unique skill set. Remember, at the end of each day, the goal is to support your community health center's mission and vision to provide high quality care to all. As community health centers, we want to be the provider and the employer of choice. And you know what? That means working in a team-based care and working together on measurable goals. And finally, support your colleagues. We want to be there for the people we work with. When a colleague is overwhelmed, it's important that you show kindness and empathy. Perhaps you have a colleague that's running behind and they need to room a patient, or the phone is ringing because someone at the front desk is needing a medical question answered. Take the time to help out. Think about a time when you needed help and someone helped you. Return the favor. We all need to work together. Because remember that a cohesive team leads to a positive work environment and better patient outcomes. So here are some final thoughts. We're only as strong as our weakest link. So work together to be strong and have a positive workplace. And we all matter in our community health center. We are unable to complete tasks without each other because at the end of the day, we want to provide the best possible care and be known as the place where patients want to receive care and be a great place to work. Thanks for watching this short on-demand video. For any questions, please reach out to the Health Center of Nebraska.